I'm Dr. Colleen Spees from The Ohio State University, and I am so honored to be here today to get to ask a few questions of Dr. Cheryl Anderson. And the first one, I'd love Dr. Anderson to introduce herself and talk about why she's here today.
Thank you so much, Dr. Spees. I'm Cheryl Anderson. I am a professor, and I'm the founding dean of the Herbert Wertheim School of Public Health and Human Longevity Science at UC San Diego. It has been an honor to be invited by this, my beloved epidemiology and lifestyle and cardiometabolic health community to give the David Kritchevsky lecture. And so today I had the opportunity to talk a bit about what I've titled Traveling the Last Mile, what we can do to have a sustainable impact of diet on cardiovascular health.
I love it. And the lecture was wonderful. And I really loved the traveling the last mile, but I'm going to back you up to one of the first miles. So you shared a little bit about your connections early on with the American Heart Association and what got you interested in research. And I would love for you to share that.
Yeah, so thank you. I grew up in a small farming community in Palm Beach, Florida, and I spent most of my childhood there in a community where we have migrant workers who live alongside local families, producing a significant amount of the state's produce without a single grocery store or even a fresh produce stand. After my 10th grade, I had a summer experience in a summer science and math camp at the University of Florida. And this experience, I found out later, was paid for by the American Heart Association. And so I'm so grateful that I have found this community that cared and invested in me at the very early, to your point, first mile of my own development. And now when I come to this work, I come with the perspectives of someone who's lived the experience of what I'm trying to do with my research. I come with the perspective of how important it is to invest early in people who can help us with the work, and I lift as I climb.
I love that. Thank you for sharing. So let's go on in the miles and talk about sort of your mid-career and some of, in hindsight, the experiences that your research and your training and all of that, and the experiences through the American Heart Association led you. You talked a lot about adherence and where we are. We know what to do as a society, and you have certainly been a huge part in defining many of our recommendations on a national level for diet and physical activity. And remind us, or where we are now, I guess, at this point in time along the mileage, in terms of what we need to be doing better and thinking about.
Yeah. So, Colleen, it's so interesting when someone else hears your work and they project back to you what they're hearing, because I'm learning and growing even in the question that you're asking in terms of how to tell this story. So you so keenly picked up on the fact that it's been a journey. And that journey has included some pivotal moments in my early life, my early career. And then I stopped today to talk about mid-career, what happened when I was leading my very first behavioral intervention study. So I was trained in a time when the school that I went to for nutrition taught me how to do beautiful, elegant, like highly controlled nutrition studies. That's how you get the best results. And then I was also concurrently enrolled in a public health program where I was learning about the larger observational epidemiologic landscape and how you might use that to answer questions. And the two things were a bit at odds, right? And I had come from a background where I had health behavior, health education training as well. So I'm trying to figure out how all of these things fit together. So I'm doing a behavioral intervention study, and I have Larry Apple, who I've been stargazing at since my training, as my primary mentor. And he's really good at these very elegant nutrition intervention studies. So we had that as a component of the work. Because I was trained in behavior change, we had a behavior component of the work. And then the results just didn't sit well with me, right? They were to be celebrated. We got these really amazing differences between our intervention group and our control group. But the ability to get adherence, maintain difference, but yet not maintain the adherence to the recommendation, that was the gap that bothered me. That was the gap that gave me pause. That was the gap that brought me back to that community that I grew up in. And I thought, how am I going to do this work differently moving forward? So thank you for the opportunity to reflect on that.
Well, and moving forward from that, what is the call to action? What do we need to do? You also mentioned having a healthy and sustainable food system that's very broad. And how do we do that? What are we to tell people? How are we as researchers and as public health advocates and and also representatives from the American Heart Association, what is the message and what is our call of action?
First, as a community that understands public health, we have to rely on some of those basic public health principles and frameworks as we do these more involved scientific explorations. So, for example, I mentioned the socioecological framework, which you see in things like our Life's Essential Eight. You see it in some of the policies that and statements that we put forward and some of the advisories. However, we haven't really gotten the science and the commitment to doing that type of dissemination and implementation work in terms of the way our studies are funded, the amount of time that we have to do the work, and the criteria that we hold people to in doing the work. And so I would say, think about that health impact pyramid, right? We've been working at the top of that pyramid instead of at the base of the pyramid. And we know the things at the top, they are indeed impactful, but they're less impactful than the things at the bottom. And so my call to action is that we galvanize, and no matter what our differences, no matter if you grew up in a place like I did, or if you currently live in a zip code that doesn't have resources, or if you come from a different background, your personal background is different, it's going to take all of our commitments to do this work. It's hard work and it's heart work.
I love that. So, thinking down at the end of the journey now, we're on the last mile. Where do you see us all in 15 or 20 years? What is the hope for us? What would you love? What's the dream?
So, I'm imagining Epi Lifestyle 2044, and for us to be able to say our accomplishments include having shifted our communities such that people have access to healthier foods. And that happened because we dared to bring our community based organizations to the table consistently in a way that honors their voices, in a way that's bi directional, where we're truly learning from the things that they already know to be true. And so I also look forward to maybe the NIH, the National Institutes of Health, being truly organized in a way that allows us to address the determinants of health, social determinants, economic determinants, political determinants, rather than honing in on that disease that we're trying to figure out. And I hope that, 20 years from now, we have coverage for patients who are in need of food as a way to treat their health conditions, right? That's not a struggle, and that each and every one of us can indeed experience health and hope no matter where we are.
I love it. Thank you so much for your
Amen.
time today. And you can see why the American Heart Association and Epi Lifestyle is thriving because we have the leadership of wonderful people like setting the stage that we can look up to, just like in your lectures today, and the people we have and we remember in memorials like this, that we are living the dream and making a difference, hopefully. Thank you.
And thank you to Dr. Kritchevsky and the memorial lecture that allowed me to be able to share this beautiful story today. So thank you.